Workforce and the indirect costs of research are two of the most critical aspects that our members raise with us and are probably the two areas that keep me up at night. My name's Saraid Billiards. I'm the CEO of the Association of Australian Medical Research Institutes, otherwise known as AAMRI. So we are the peak body that represents medical research institutes across Australia. Within our institute base, we have about 20,000 researchers and students, so a pretty good proportion of the health and medical research sector in Australia. And our role primarily is to advocate on behalf of the medical research institute sector, one that is primarily important in terms of the focus that they do, which is purely on research. AAMRI's primary role is advocacy. We support our members through multiple different avenues. So one area is by bringing all of our members together at our annual convention, which we typically hold in November in Canberra. And this is an opportunity to highlight the key issues that are facing our members, looking at policy opportunities and opportunities to also mix and discuss opportunities with politicians as well. In addition to that, we also prepare submissions to various government briefs, and one of those currently is the Draft Health and Medical Research Strategy. In addition, we also have many conversations with politicians, senior departmental officials to really highlight and emphasise the importance of health and medical research, but also the importance of medical research institutes in particular. AAMRI's members are spread across Australia, so we have representation in every state and territory. And the types of research that they do is wide and varied. So they do research from the discovery, basic science, right through to health services research, commercialisation, translation. The depth and the breadth of the research that they undertake is quite extraordinary. Some institutes will have a primary focus on basic science, but a lot of our institutes are actually multifaceted. So they do cover the broad spectrum of health and medical research. A lot of our institutes are very integrated within the health sector, so they work closely with hospitals, so have great engagement with clinician researchers to really embed the research into the clinical setting. And more, our members are also having strong collaborations with industry as well to be able to commercialise the research outputs. But fundamental basic research is still critical to ensure that you get that pipeline of discovery research right through to translation and commercialisation. And that will not just be in terms of commercialisation of outputs, but it's also translation of research into policy, into practice, which is really critical for health services sector, for public health and other areas as well. We've been advocating for a national health and medical research strategy for several years now. We published a white paper a few years ago, which was really articulating the need for a national health and medical research strategy because we've never had one in the country before. Back in 2013, the McKeon Review did do an overview of the health and medical research landscape. And back then they identified a series of areas that really needed major reform to ensure the sustainability and growth of the sector. So it was really pleasing to see Minister Butler last year announce that they were going to develop a draft National Health and Medical Research Strategy, and we've been working with the Minister, his office, and then subsequently Rosemary Huxtable along the way. We've participated in opportunities of addressing the need for the strategy and participated in various conversations, roundtables, submissions. I'm also part of the technical advisory group, which is a group of individuals reporting to Rosemary Huxtable to inform the implementation of the strategy. But prior to that, we really need to make sure we get the strategy right. So AAMRI will continue to work with government and produce submissions to ensure that whatever the final strategy looks like, it's actually as impactful as it can be for our sector. When the draft strategy was released not too long ago, I think there was an air of excitement and anticipation from our members and from us as well. As I said earlier, it's the first time that we've got a draft National Health and Medical Research Strategy, and the idea really was to ensure that this strategy could underpin a robust, viable and healthy health and medical research sector in Australia. There were no surprises in the strategy. A lot of the areas that have been identified actually have been flagged back 12 years ago in the McKeon review. So some of the feedback that we've received from our members is there were no surprises, nothing new. It's quite high level, and I think the devil is in the detail. Our members also were a little bit concerned in terms of how this was going to be implemented. There's really no detail in the implementation. There's definitely no acknowledgement of potential additional funding. It does talk about streamlining of funding that's currently available, and we welcome any alignment and more efficiencies and streamlining between NHMRC and MRFF. But I think, what does this actually look like? What's the tangible outcomes of this strategy? We have a short period of time for which we can provide feedback. Rosemary Huxtable is leading a series of roundtables around the country, working closely with state governments as well, which I think is really important, because to be able to effectively roll out a healthy, vibrant health and medical research ecosystem, you need buy-in from the state governments as well. So the feedback sessions and the submissions from anybody who would propose to provide a submission closes on the 8th of October, so it's not that long away. Workforce and the indirect costs of research are two of the most critical aspects that our members raise with us, and are probably the two areas that keep me up at night. So in terms of workforce, we really need to make sure that we've got systems in place that ensure the longevity of research careers, but also ensure that we've got our future leaders to have a vision for what their future will look like. These early mid-career researchers are our future leaders. And currently, with the way the system is set up in terms of the short-term contracts, low success rates for funding, and the precarious nature of future careers, we run the risk of losing our future generation of researchers. Now, to be able to support that future generation of researchers and our current trailblazing researchers as well, we really need to address the elephant in the room, which is indirect costs of research, or what we could call the enabling costs of research. So the indirect costs of research is really the backbone of research, the behind the scenes of research. And the definition for indirect costs of research hasn't changed in over 30 years, and it's not keeping up with contemporary research as it currently stands. So as an example, indirect costs of research which aren't covered by government grants and aren't typically covered by fundraising and philanthropy include things such as data repositories, the IT that makes sure our data is safe and secure, the specialists that are required to help commercialise research, the individuals who are critical to deliver clinical trials, such as clinical trial coordinators and so forth. Now, without these people, the research wouldn't be able to get done, but the funding for these critical elements of research cannot be derived from government grants or possibly not fundraising and philanthropy as well. So our member institutes actually have to find additional money to be able to support the research as it's rolling out. And this is a big issue for our sector because it is crippling the sector. And the concern is that we are on the brink of serious concerns for the viability of the medical research sector. Through the strategy, it does identify translation and commercialisation quite heavily. What it doesn't actually highlight, and to be fair, Rosemary Huxtable has asked for feedback on what the metrics of success look like. And I think we need to give great consideration of what the metrics of success looks like for the entire spectrum of research, from fundamental discovery research right through to translation and commercialisation. The issues that we've got in terms of identifying appropriate metrics is that the strategy is quite broad and quite wide-ranging and very, very high level. So it's really up to government to identify what they consider that would be good indicators of success, and it could be workforce, it could be the number of patents that are rolled out, spin-out companies, attraction of funding from international venture capitalists, fundraising philanthropy. It could also be the number of clinical trials that are being undertaken in Australia. I think what we've realised, particularly just recently with the budget cuts from the National Institutes of Health from the US, we really need to recognise what we need to do to ensure our sovereign capability in the country, and what does that look like. And so that investment, not just from government, but also from fundraising, philanthropy, commercial, really ensures great success in the research that's being done. So there could be multiple areas that would be indicators of success. I think the key areas would be to ensure that we have a healthy sector that grows and that we protect the future generation to ensure that they will become our future leaders. The strategy should be finalised by the end of the year. This will be following the review of all the submissions and the roundtables that have been undertaken currently thus far.